Welcome to the Victory Education Lounge. I'm your host, and today we're diving into a fascinating and crucial topic: thyroid disorders and insulin resistance. This is part 102 of our ongoing series on metabolic health. Before we begin, please take a moment to like this video. Subscribe to our channel and share your thoughts or experiences in the comments below. Your engagement helps us reach more people with this vital information. Many people don't realize the intricate connection between thyroid function and insulin resistance. Whether you're dealing with thyroid issues, insulin resistance, or simply aiming to optimize your overall health, understanding this link is crucial. Today we'll explore how thyroid disorders and insulin resistance interact, and discuss solutions, management strategies, and prevention methods. Did you know that thyroid disorders and insulin resistance are intricately linked? A surprising fact, isn't it? But as we journey through the fascinating world of metabolic health, we're uncovering more and more about how these complex systems within our bodies interact. Today we're delving into the relationship between thyroid disorders and insulin resistance, and believe me, it's an exploration you don't want to miss. Understanding this link is not just for those dealing with thyroid issues or insulin resistance. It's crucial knowledge for everyone aiming to optimize their health. We'll be taking a closer look at how these two conditions impact each other and, more importantly, discussing solutions, management strategies, and prevention methods. So whether you're a health enthusiast or someone dealing with these conditions, there's something in this for you. Let's delve into how these two conditions impact each other and what we can do about it. First up, let's explore how an underactive thyroid or hypothyroidism can lead to increased insulin resistance. Hypothyroidism occurs when the thyroid gland doesn't produce enough thyroid hormones, which play a critical role in our metabolism. When our thyroid is underactive, our metabolism slows down, which can lead to weight gain and fatigue, among other symptoms. Now, you might be wondering, how does this relate to insulin resistance? Well, insulin is the hormone that allows cells to take in glucose, our body's primary source of energy. When cells become resistant to insulin, they can't absorb glucose as effectively, leading to high blood sugar levels. This situation can eventually lead to type 2 diabetes if not managed effectively. So, how are these two conditions linked? Studies have shown that hypothyroidism can actually increase insulin resistance. This is because a slower metabolism can lead to weight gain, a key risk factor for insulin resistance. Additionally, thyroid hormones are believed to directly influence insulin sensitivity. Managing these two conditions together can be a bit of a balancing act. Treatment typically involves thyroid hormone replacement therapy to restore normal thyroid function. This can be done using synthetic thyroid hormone medication. However, it's also essential to make lifestyle changes to improve insulin sensitivity. This can include adopting a low glycemic diet, which consists of foods that don't spike your blood sugar levels, and regular exercise. The upside of this approach is that it can significantly improve overall metabolic health. However, it may require ongoing medication and regular monitoring of both thyroid and insulin levels. Let's take the example of Sarah. She's 42 and was diagnosed with hypothyroidism. After starting on thyroid medication and adopting a low glycemic diet, her insulin sensitivity improved by 30% in just 3 months. Plus, she lost 15 pounds. So while dealing with hypothyroidism and insulin resistance might seem daunting, it's important to remember that with the right medication and lifestyle changes, it's possible to improve insulin sensitivity even when dealing with hypothyroidism. Now let's flip the coin and look at how an overactive thyroid or hyperthyroidism can lead to impaired glucose tolerance. In cases of hyperthyroidism, the thyroid gland produces an excess of its hormones. This overproduction can speed up your metabolism, causing unintentional weight loss and a rapid or irregular heartbeat. But did you know it can also affect your body's ability to metabolize glucose? That's right, an overactive thyroid can lead to impaired glucose tolerance. This means your body struggles to maintain stable blood sugar levels after eating, which can lead to prediabetes or even type 2 diabetes if left unchecked. So, how do we manage this? The first step is to treat the underlying thyroid condition. This may involve medication, radioactive iodine, or in some cases, surgery. Once the thyroid issue is under control, the focus shifts to monitoring blood sugar levels regularly to catch any potential issues early. The benefits of this approach are clear. Addressing the thyroid issues can help normalize glucose metabolism and prevent the onset of diabetes. But it's not without its challenges. It may require careful medical management, including regular doctor's visits and medication adjustments. Let's consider an example. John, a 38-year-old man, was diagnosed with Graves' disease, a common cause of hyperthyroidism. He received appropriate treatment for his condition, which included medication and regular checkups. With his thyroid levels finally balanced, his fasting blood sugar levels normalized within 2 months. This is a clear demonstration of how managing your thyroid condition can help regulate your glucose metabolism. But remember, every person is unique, and what worked for John might not work for everyone. It's always essential to consult with your healthcare provider to create a management strategy that suits your specific needs and circumstances. So, while an overactive thyroid can indeed lead to impaired glucose tolerance, with the right management and medical care, it's a challenge that can be met head-on. Remember, the key lies in treating the underlying thyroid condition and keeping a close eye on blood sugar levels. Addressing thyroid issues can normalize glucose metabolism, but it may require careful medical management. It's also important to understand the link between autoimmune thyroid diseases like Hashimoto's thyroiditis and insulin resistance. Autoimmune thyroid diseases are conditions where the immune system mistakenly attacks the thyroid gland, leading to inflammation and impaired thyroid function. Hashimoto's thyroiditis is the most common of these conditions. This immune response can also affect the body's insulin sensitivity. Research shows a higher prevalence of insulin resistance among individuals with Hashimoto's thyroiditis compared to those without this condition. This is likely due to the inflammatory response disrupting insulin signaling pathways, causing a decrease in insulin sensitivity. So, how can we manage this? The key is to address the underlying autoimmune factors. An anti-inflammatory diet, rich in fruits, vegetables, lean proteins, and healthy fats, can help reduce inflammation and improve insulin sensitivity. Regular exercise, adequate sleep, and stress reduction techniques like meditation or yoga can also support immune health and improve insulin response. Supplementing with key nutrients like selenium and zinc may also be beneficial, as these have been shown to reduce thyroid antibodies and support thyroid health. Regular monitoring of both thyroid and insulin function is also critical to assess progress and adjust management strategies as needed. Let's consider an example. Lisa, a 45-year-old woman, was diagnosed with Hashimoto's thyroiditis. She adopted an anti-inflammatory diet and began practicing daily meditation. Over 6 months, her thyroid antibodies decreased by 50% and her insulin sensitivity improved significantly. However, these changes required significant commitment and lifestyle adjustments. So the pros here are that addressing autoimmune factors can improve overall immune function and metabolic health, potentially reducing the risk of other chronic diseases. On the flip side, the cons are that it may require significant lifestyle changes and ongoing monitoring. In conclusion, the link between autoimmune thyroid disease and insulin resistance highlights the interconnectedness of our body's systems. By addressing inflammation and improving immune health, we can enhance insulin sensitivity and support overall metabolic health. Improving overall immune function and metabolic health is possible, but it may require significant lifestyle changes. Did you know that thyroid hormones also influence pancreatic function and insulin secretion? This complex interaction plays a pivotal role in maintaining our metabolic health. When we think about thyroid hormones, we often think about their role in regulating our metabolism, but these hormones do much more. They also influence the function of our pancreas, an organ responsible for insulin secretion. Insulin, as you may know, is crucial for regulating our blood sugar levels. When thyroid hormone levels are off, it can affect the pancreas and disrupt insulin secretion. This, in turn, can lead to insulin resistance, a condition where our cells don't respond well to insulin, causing high blood sugar levels. So, how do we manage this? The key lies in achieving optimal thyroid hormone levels. This involves regular monitoring of your thyroid function, and if necessary, taking appropriate medication to balance your thyroid hormones. But it's not just about medication. Supporting pancreatic health through diet and supplements can also make a significant difference. A diet rich in whole grains, lean proteins, fruits, and vegetables can provide the nutrients your pancreas needs to function correctly. And certain supplements like chromium and magnesium can help improve insulin sensitivity and support pancreatic health. The benefits of managing this intricate connection are immense. Achieving optimal thyroid hormone levels can improve overall metabolic balance, leading to better energy levels, weight control, and overall health. However, it's important to remember that this may require careful medical supervision and adjustment. Everyone's body is different, and what works for one person may not work for another. It's crucial to work closely with your healthcare provider to find the best approach for you. Take the case of Mike, a 50-year-old man with subclinical hypothyroidism. After optimizing his thyroid hormone levels and incorporating a nutrient-dense diet with specific supplements, his pancreatic function improved remarkably. This led to a 25% increase in insulin sensitivity within just 4 months. Achieving optimal thyroid hormone levels can improve metabolic balance, but it may require careful medical supervision and adjustment. Lastly, let's look at how insulin resistance can impair the conversion of T4 to the active T3 hormone. When the body becomes resistant to insulin, it can disrupt the delicate balance of thyroid hormones, particularly the conversion process from T4 to T3. This can lead to a condition known as low T3 syndrome, which is often seen in individuals with insulin resistance. To manage this, it's crucial to improve insulin sensitivity. This can be achieved through a combination of a balanced diet, regular exercise, and sometimes medication. Also, supporting thyroid function with appropriate nutrients can help optimize the conversion process. The pros of this approach are significant. It can enhance overall thyroid function and metabolism, leading to improved energy levels and weight regulation. However, the cons are that it may require a committed effort and lifestyle change. For instance, consider the case of Emma, a 40-year-old woman who, through a committed diet and exercise program, improved her insulin sensitivity and enhanced her thyroid hormone conversion within 6 months. Improving insulin sensitivity and supporting thyroid function can enhance overall metabolism, but it may require a committed effort. Remember, managing thyroid health and insulin sensitivity requires a comprehensive approach. By addressing both aspects, you're not just treating individual symptoms, you're supporting your overall metabolic health and well-being. Thank you for joining us in the Victory Education Lounge. Don't forget to like, subscribe, and share your thoughts in the comments. Your experiences could help others on their journey to better health. Disclaimer: the information provided in this video is for educational and entertainment purposes only. It is not intended as medical advice. Any health-related decisions, especially those related to thyroid health and insulin resistance, should be discussed with a licensed physician or qualified healthcare professional.